Hi there, Mrs. Jones. My name is Claire, and I'm going to be your nurse today. I'm here to do a postpartum head-to-toe assessment. So I just washed my hands and I put on a fresh pair of gloves so we can get started. First, can you tell me your name and date of birth? Okay, great. That matches my records and your wristband. So basically, first I'm going to do a round of just regular vital signs, and then I'll do an assessment from literally your head down to your toes. Alrighty, so make sure the camera's still on. Hang on a second. Okay, good. Alright, so let's see. First, I will connect the blood pressure cuff and take your blood pressure manually. With the machine, and it is in normal range of 120/60. Next, I am going to take your temperature. So if you want to just open your mouth, and okay, great, 98.6. And now I'm going to listen to your heart sounds for 1 full minute. Okay, apical heart sounds are normal, and her heart rate is also normal, and it's on the computer as well. Next thing I'm going to do is listen to her breath sounds for 1 full minute, her lungs and breath sounds, and get her respiratory rate. Breath sounds are normal, and she's breathing at 8 respirations per minute. This time I would also assist her into gently rolling over a little bit and listen to the breath sounds on her back as well. All right, Mrs. Jones, how are you doing? Good? Okay. Let's see. So I'm also going to record your pulse ox. So I'm going to put this on your finger for a moment, and 96%. That is great. All right. So now we can move ahead. Let's do some neuro. Can you tell me, just answer a couple questions. How are you feeling? You feeling good? Okay, that's great. Can you tell me where you are and what year it is and who's our president? Okay, good. So it sounds like you are alert and oriented. And so I'm gonna just check out your eyes for a second. So your eyes are reactive and responsive, and you want to just follow this for me. Okay, great. So it looks like everything is going good so far. So the next thing I'm going to do is actually do a breast exam. So I'm going to lower your blanket a little bit, and I'm actually going to gently touch your breasts. They feel warm and full, but I don't see any redness or streaking, no mastitis present thus far. Your nipples are looking a little bit pink and swollen, but there's no cracking. How are they feeling? How are your breasts feeling? Okay, they're sore. Yep, that sounds pretty normal too. It looks like they're very full, and one is a little bit bigger than the other. That's also very normal. So it might be about time to breastfeed once we're done with this exam. And if your nipples are continue to be really tender, what you can do is there's some nice salves to put on after you breastfeed, or there's also these really great little circular frozen patches, you can keep them in the freezer, and then after you breastfeed, put them on your breast for 10 to 20 minutes, and that really helps a lot too. But all in all, everything looks good there. That's great. Oh, and I also noticed that your nipples are not inverted, they're everted, which is great. That should really help with breastfeeding. And if you have any problems with breastfeeding, just let us know. There's a lot of resources. We can help you, and we can also refer you to a lactation consultant, which would be able to help you as well. Okay, so moving down, I'm gonna actually listen to your bowel sounds and see if we've got any movement down there. I'll lower your blanket again. Okay, great. So I definitely could hear your bowel sounds. They're a little bit hypoactive, but that's normal. Can I ask you, when is the last time you've eaten or drinking? Okay, so you've had a lot of fluids. That's great. That's great. That's going to be really good for your body as it's recovering. Are you hungry right now? Do you want me to coordinate a meal for you? You can order from the cafeteria, or maybe we can get your family member to help you out with that. Okay, let's do that. Then you're probably going to be really hungry for a while. I know you just went through a lot. Okay, so moving on, I am going to check to make sure that your uterus is in the right place. So we just want to make sure that it is healing up right. So I'm going to below here, above the belly button. Okay, the uterus feels firm, and it's also midline. It is in the right place. It doesn't seem to be off to the side, so that's good. I noticed that you had a vaginal birth, so we don't have a cesarean incision to deal with, so that's also great. And let's see. Okay, so now what we're going to do is move further down, and I'm going to actually do a vaginal exam. So I'm going to raise the head of your bed while we do this and get you comfortable. And I'm just going to check out your vaginal area to make sure that everything looks okay. So I'm going to bring up your blanket here, and I can see that your pad has a moderate amount of blood in it. And so when was the last time you changed your pad? Okay, about 2 hours ago. Okay, so that's not out of normal range, but continue to monitor that. I'm looking here for redness, bruising, edema, any kind of discharge, and then incision approximation. So there was no incision down here during your birth, so that's great. It is a little bit red and swollen, but that is normal since it's only a day out from your birth. There doesn't seem to be any edema or discharge, so that's really great. Have you noticed any blood clots when you're in your pad or in the toilet when you pee? Okay. Well, blood clots are normal. Just let us know if there's any clots that are bigger or the size of a golf ball or bigger, because we would want to actually weigh that and make sure that we know about that. Let's see, like I said, there's no incision, so that is good. Okay, so now I want to ask you, when is the last time that you urinated? A few hours ago? Okay, so I just want to, give you a heads up, like try to just tell you, you might not be able to feel it. It's pretty normal in the first week after birth to not have the strongest urges to pee because everything's healing down there. So if you could try to make it a point to just make it a habit to just go urinate every 2 hours, that'll be great, and it'll help keep your uterus in the right place. And while you're there, you can do a little perineal care. We've got this nice little spray that can if you're having a lot of pain down there, it can help numb it for a little while. And also you can change your pad while you're in the bathroom and just kind of keep track of how much blood is coming out, and and then keep it clean down there too, so that you don't, get at risk for infection or anything like that. So moving on. All right, so now I'm gonna move down to your legs, and your legs look good. I'm gonna do both pedal pulses for 1 minute on each side, and I don't see any edema or swelling. The cap refill in the toes is less than 2 seconds. And now I'm going to do the Homan sign. So if you just will, relax your leg into my hand, and then dorsiflex your foot, and let me know if you feel any pain in your calf. No? Okay, that's good. Let's do it on the other side. So relax your leg, dorsiflex your foot, and do you feel any pain in your calf? No? Okay, that's great. Okay, so we're just checking for risk of deep vein thrombosis. We want to make sure you don't have any clots going on. And just going to check your arms as well. I don't see any swelling in your extremities. And can you feel everything okay in your fingers? Can you feel that? Okay, great. And I notice your cap refill is less than 2 seconds. And everything looks good there. So let's see, just want to make sure I haven't missed anything. So how are you feeling emotionally? Are you overwhelmed? Are you feeling pretty good? Are you tired? Okay, great. Well, do you have, what is your family support system? You have your husband coming, or your sister, or your mom, and you have some support for when you go home. That's great. Is there anything you're concerned about right now that I can help you with, or find you some resources to help you with? Okay, great. Let's see here. Let's see. I guess I just want to also check in on if you're having a lot of pain anywhere specifically. Is it hurting below or hurting above more, or, anything that's, too much or feels abnormal, please let me know, and we can address it and look into what's causing it and hopefully help you feel better. I think that concludes my assessment. So please let me know if you have any questions. Your call bell is right here. I'm going to go ahead and lower your head a little bit, your bed a little bit more, and help you feel comfortable. All right. Okay. Okay, sweetie. I'm going to come and help you right now. All right, thank you so much, and let me know if you need anything. I'm going to wash my hands and document my findings in the computer. That's it. Thank you so much. Bye.